Hey gang, it is Wednesday. Hopefully you guys have all put the hand pieces down by now, but more importantly, it's hump day. That means it's time for happy hour with your dentist in the know. This is your backstage look at current trends, politics, and education in the dental world. It is live and it's over a cocktail. Tonight is a beer kind of night. So I'm sipping on a Corona over here. I'm Dr. Jeff Horowitz. My co-hosts are these fine people, Dr. Chad Duplantis and Dr. Jennifer Bell. We're all practicing dentists. We're all educators. We're all business owners. And our job is to bring all of you in the know. As you saw in the video tonight, our show is brought to you by our partners at Q Optics and Quality Aspirators. They're the fine people that make the safety suction you just saw. So welcome to all of you. Anyway, guys, we have another amazing show for show number 99. We have a very special dentist, a special friend of the Dinks. He actually started a network for younger dentists called IgniteDDS. Extremely well educated guy, great educator himself. And we're proud to talk about our new collaboration with him. So Dr. David Rice is on the show again, but that's coming up. And right now, I think it's time to let JB talk for a while.
You want to talk news? You ready?
Yes.
Okay.
I want to talk news.
First off, I just want to, we birthed, is that the right word? But our podcast is back. It had a long hiatus because we're only 3 people and only have so much bandwidth. But we have reopened up our podcast activity. So if you haven't subscribed, wherever you get your podcasts, literally wherever you consume that information, you can subscribe to Dentists in the Know. We just posted 2 this week. One podcast you can only get in podcast form. That was with Jason Smithson. That was a really fun conversation about adhesive, direct and indirect dentistry. He was coming to us from the UK, so that's why we had to do a pre-recorded format. So you can get that on our podcast channel. And then we also released our interview with Dr. Pam from last week, as a kind of synopsis of what we talked about with her. So those are 2 great places that you can consume what we talk about here live every week. And we'll keep that up to date, and you can get that information on the go if that's more convenient for you. So I wanted to make sure we mentioned that. I have some really interesting news pieces for you guys to digest today. Jeff, be ready because we can talk about it when he lets you come back on. The first... He let himself back on. So last week we talked about this new fluoride system that's being released. It's a tablet system for municipalities to kind of update some of the antiquated fluoridated equipment that's out there, then hopefully reduce the cost of fluoride leaching systems. Oddly enough, though, this week, another article came out based on some meta-analysis of kidney function in adolescents with high fluoride rates. And so what they were looking at was kids that did have poor kidney function based on an analysis had higher levels of fluoride in their plasma. And you can interpret that multiple ways. Is it the chicken or the egg? Do they have the high fluoride plasma levels because the kidneys aren't functioning correctly? Or do they have poor functioning kidneys because of high fluoride levels? What it did highlight, and I think it's worth discussing again, this has been a consistent platform and dialogue topic for the anti-fluoridation crowd, and it keeps coming up in different analyses. And so I think it at least is something as clinicians we need to be mindful that consumers may be seeing this type of data out in mainstream media, but also just in different circles where they're consuming different research topics, and that there is continuing to be research in the area of high fluoridation risk with kidney function. And certainly as clinicians, we would never want to participate in programs that wasn't mutually beneficial to the human form, as well as reducing caries. So I think, in anything we do in science, there's always this constant evolution of getting better. And so we continue to see research diving in on those fluoridation programs. And I think that's always good to be mindful. And we know there's trickle down effect. And so trying to understand how much consumers are really getting of fluoride on a daily basis continues to be a bit of a challenge. So here's another interesting article that came out this week. So there's a Japanese film crew that's coming out to, hold on, I want to say the correct place, St. Louis. So I'm going to go back into the time capsule bit because in fairness, I was not alive during this time period. But during a period in the 1950s, we were doing a fair amount of nuclear bomb testing here in the US. And so they were doing testing in different sites, a lot in New Mexico and Nevada. So there was a study that came out called the Baby Tooth Survey that came out that was looking at how much trickle-down exposure of nuclear waste was happening from these large bombing events that were happening throughout the US. And oddly enough, they were taking recycled baby teeth. So as they were falling out, they were doing data analysis on this. And they were collecting it on kids in the St. Louis area. And they were finding a pretty substantial increase in radioactive waste and baby teeth in that area, higher than if they went back before they were doing the nuclear bomb testing in the US. So a Japanese filmmaker who obviously probably lived through the nuclear bombs of World War II, or had some, he probably didn't live through it, but he had some exposure to the repercussions of that in their country, is fascinated by the nuclear waste manifestation of nuclear bombs. So he's coming back to actually film a documentary on the Baby Tooth Survey. That survey, that study was so effective that JFK actually shut down our nuclear testing program in the US after the data came out. So really fascinating. I learned a lot actually reading through this article today. I was not familiar with the Baby Tooth Survey, but even more so, it looks like there'll be some additional highlight of that particular moment in our US history and what the implications of that data gathering and dentistry being kind of at the center of how that was collected. The last thing we're going to talk about today, there really isn't a lot to report on the Capitol legislative side. We talked a little bit about those things last week. We're about to enter the lull period for most governments and their activation of different laws and regulations. So I think that will probably be on the lower end of our discussion. The third thing we're going to talk about is another article that came out this week, starting to again make correlations between hypertension and tooth loss. And there was some obvious oversights in the article, that there was some ways that they had to cull the data that they couldn't really isolate for age and some other things. So there definitely are some improvements that could be made on the research side of the article, not to the fault of the researcher, but just in any study, you kind of have to cull it down to, we're just going to focus on these particular data points. But what they did mention, and I thought was interesting as a clinician reading this study, is if you have a patient that's continuing to experience a lot of sequential tooth loss, it seems to be perpetually occurring to that particular patient, that pre-screening for or screening for hypertension in that process might be warranted, because there does seem to be a consistent correlation between hypertension and tooth loss. Now, again, it goes back to chicken or egg. Is the tooth disease driving the hypertension, or is the hypertension driving the tooth disease? And that's always more difficult for scientists to really cull down. But if you're seeing some of those factors presenting in your practice of consistent tooth loss, might be a good opportunity to ensure that those patients are being screened for hypertension. So tonight we really talked science. That's kind of the news in a nutshell. There was another interesting thing that Ferran put out not that long ago, a few hours ago, about open dental positions basically throughout the US, specifically dentists. And it was pretty fascinating how that distributed out. I'll post that tomorrow if you want to take a peek at it. I'm trying to figure out how to make correlations between certain states that have higher open positions versus others. And I don't know if the open positions are because the populations are still much higher in those states, or because of population spread that we know is happening, where we have a significant number of folks leaving California, New York areas and migrating to other states. And so are we seeing a displacement of our professionals into other states because of the migration spread, or is the population growth or density still so high that we don't have enough clinicians to service our community? So I'll post those numbers tomorrow, and then we can have fun hypothesizing what they mean.
Well, that'll be really interesting. And yes, JB, I do like science.
I knew you would.
Yes. So here's my question though, is because, when you have these kind of correlation studies, it's not even necessarily chicken or egg. It's like, okay, so there's high blood pressure. What other comorbidities are associated with high blood pressure that could be the cause effect? There's just so many.
So hard to really.
Right. But it's actually good to say, okay, if the patient has high blood pressure, it should make you raise an eyebrow, or it should be a reason to encourage patients to take care of their high blood pressure.
Right.
We don't know what the cause and effect is. All we know is we're seeing these things together. So, there's got to be something to that.
Correlation is all we have at the current moment. So
Very
did you know
interesting,
about the baby tooth survey?
I did not.
Yeah, that was new for me.
Yeah, but I'm pretty sure I'm the victim of nuclear fallout. At least that's what my parents told me my whole life.
Again, cause or effect. We don't know. We just don't know. But we do know there's a correlation. That's what we know.
Exactly.
Well, that's all I have, guys.
Well, great stuff.
Thanks.
What do you think about bringing our guest on?
Let's do it. Let's bring our guest on. I think he's probably bored right now.
Out of his gourd.
Yeah, he's bored out of his gourd.
Never bored. Never bored.
There he is. David Rice of IgniteDDS.
Yeah.
That was my 15 seconds. I love it.
Yeah.
Yes,
thank you. Have a good night.
Bye, David.
You guys been talking to my wife? Come on now.
Yeah. She said, she's like, seriously, what has he been doing for the past hour and a half or so?
Yeah.
I think she's thanking you. It's like peace for her.
Yeah. My wife is, enjoying her wine and then for quiet time and stuff like that. So thank you for being here, David. So
David, are you enjoying a beverage this evening?
In the spirit of Chad Duplantis, I feel like bourbon is always a decent beverage to have at this hour.
Yes, of course.
Concur.
Does that make me a bad
good?
man?
So
no, it does not. I actually like you better right now. You're in the club.
Let's start it off, David, and just I know we had you on a few months ago, but just for those that weren't here, tell us about IgniteDDS, and we'll point those questions a little bit, but just let's do the overall view. What's IgniteDDS?
Yeah, sure. 30,000-foot view is we are a community. Our main goal is to help young dentists be better entrepreneurs, better clinicians, basically build the life that they want. I think there's too many folks in all walks of life, but especially dentistry, who try to point everybody in their own direction. And our job really is to show pathways to practice that can be really successful. And we work with a ton of young dentists, and we grow them up young from dental students. So we're about 43,000 people strong on our .com, and we, play in the social media world just like you guys do too. So it's been a great journey to be here.
Did you say 40,000 strong?
Yeah, about 43,000 now.
Okay, so
I know we don't talk about it much.
That's pretty good metrics.
Yeah, we've been doing it for a while. So, we're 9 going on 10 years deep. So we've grown up a lot of dental students into young dentists over the last decade. And, really proudly, many of those young dentists have joined our team in some way, shape, or form. So our core team are all young dentists or some dental students getting to their D3 and D4 years. So it's really cool to watch them thrive.
So David, obviously, I mean, you've educated so many along the way, but What have you learned over those 8 or 9 years?
Gosh, I keep learning the same lesson over and over again because apparently this is a little hard, but I've learned where the narrow lane where my strengths are and how to surround myself with people who are better, faster, stronger, smarter, and all the other ones. And that this next generation, if you think they're lazy and entitled, you just have not met the right people. They are unbelievable. And they are absolutely going to be the people who save dentistry from the hot mess we've created.
Love it. That's amazing news to hear. I mean, it's really an encouraging thing to hear. And yeah, I've met a bunch of really young, enthusiastic, wanting to learn. They just have to find the right outlets like yours to really be nurtured and grow. But thanks for doing that. I love it.
Yeah, for sure.
When you see the young grads coming out, let's look over your 10-year journey. And we have a pandemic that we get to wedge in between that at some point. Yeah. What does the graduate now look like versus the graduate of 10 years ago? Because as clinicians out looking to hire those associates or looking to bring those folks on, it helps us to understand both the pros and the cons of where they're currently operating and what they need support on. And then how does that compare to the grads that we were exposed to 10 years ago?
That's a really great question. Can I answer it like in a couple of layers?
Absolutely.
Okay. So most basic layer is, especially with the last, couple of years in the pandemic, is they are foundationally challenged. So they really need more help with diagnostics and treatment planning. They need more help with adhesive dentistry, and they need more help with patient communication skills because they've had very limited exposure to patients. So I think that's like the small piece. The big piece is if you look over the last maybe 15 years or so, we're accepting a different student into dental school than we accepted 15, 20 years ago. Point. So when I went, the majority of the students, I believe, wanted to be dentists who were going to have a nice living as a result of being a dentist. And a fair portion of people coming into dental school today are entrepreneurs, and healthcare is their product. So understand that this is the most entrepreneurially spirited group of people you've ever met. Yes, there will be people who go to work for you and I for their entire careers, but their plan is not to make $175,000 a year doing that. It's to make big dollars. And there's a huge portion of people who plan on owning 5, 10, 20, 30 practices. That's why they went to dental school in the first place.
Do you think that the DSO surge is creating that type of student?
So,
or direct, indirect effect? I don't know.
I feel like it started with parents, and parents said, hey, this worked out okay for me, but it can work out better for you. Or similar mindset to a DSO, people saw what was happening in our industry and targeted it because of it. So yes, I think there's a DSO piece, but I think largely today, young dentists and dental students see a DSO as a multi-year, maybe 2-3 years tops, year residency. That's how they're viewing it. Most are not planning on staying there long haul. In fact, statistically, I think like over 85% leave before year 3, which probably works out well for everybody in that space. They don't necessarily want us there for 30 years. So
I think there's another interesting dynamic there. So I remember when I was growing up, one of my best friends in high school, his dad was a dentist and actually left the profession in his 50s because he was just so disgruntled and just so fed up with, just everything about the profession, just completely unhappy and completely started a new career. I've also seen a lot of statistics that on how many dentists that weren't prepared to really be in control of their own finances and savings. That, you know, a lot of people that got out of school earlier than them, that got into, you know, just an average salary job that had some kind of a pension, were retiring in better shape than a lot of the dentists, you know, that were making a higher income once they got out, but they started later. No one taught them how to be financially responsible. And, you know, they're struggling at the end of their careers, trying to figure out a way to retire. And I think that there's now a generation of people that have seen their parents struggle even with great jobs, you know, like dentistry, and great professions like dentistry. And I think they're like, well, I don't want to work all those years for that. So I could totally see where that's happened.
Yeah, so I don't recall the exact data that the ADA's HPI puts out, but it's a frightening statistic that the average, let's just say the average 65-year-old dentist cannot afford to retire and remotely live the same lifestyle they lived as a dentist. So to your point, we've had a lot of years of people with a pretty nice income who just haven't figured it out.
Right. And that's one of the reasons that, you know, we chose dentistry. You know, we want to help people. We love the profession, but everyone wants to be able to retire and live the same lifestyle that they led while they were in their profession.
Absolutely.
I wish they talked more about perishable skills and what we do as clinicians, and, you know, realistic expectations. Like, some people can do dentistry for 40 years and still leave in okay shape, but a good number of them leave short of that time period, broken physically, or don't make it even that long because they become disabled along the way, or by the time they retire, they're so broken they can't do any of the things they would love to do during retirement. And so, you know, I don't know how. I guess it's a question for you, David. How do we teach? And it sounds like these younger dentists sort of are dialed more into the understanding of the perishable skill set that comes with being a dentist, that you can't do this forever. So the entrepreneurial spirit, wanting to build practices, to hire additional folks to do some of the heavy lifting, diversifies that risk out a little bit better. You think?
It definitely does. And I think I guess the challenging side to all of it is, and you guys probably remember too, you know, when we were in our mid to late 20s and we were invincible, like nothing was going to happen to us. We were bulletproof. Nothing could happen to us. So I think
I'm still in my 20s, but I bet you guys can remember what that
you
feels
were
like.
not invincible. If you were hanging out with those Gian Grecos, you were not invincible.
I could.
I got you.
Yeah, no, but you're right. I think, but yes, I think today's, you know, younger dentist at least has a little bit better pulse on the fact that this is 40 years of doing this is, you know, not in the cards for most of us. We do get disabled. It is difficult on the back and the neck and hands and the eyes. Oh my gosh.
So that's actually a great, as Jennifer's favorite word, that's a great pivot point. Is that because you're actually teaching and working with dentists more on the oral medicine side, and that's kind of how my career ended up transitioning, was being able to use my brain a little bit more than I'm using my hands, which and my neck, you know, by the same token. So I think that that's really an important point, that is that as a dentist, you don't necessarily have to use your hands and neck your whole career. And it is a career that you can stay in well into your 60s or 70s if you mentor people behind you to get the skills that you've learned and to get some of the knowledge. But this is so important. And the other parts of what we do as dentists, like you said, the oral medicine, you know, sleep, jaw joints, you know, just there's so much out there. And just, even if you're an entrepreneur and have 5 or 6 offices and just go around teaching the other students what you already know, there's a lot to be said about doing that and not having to walk away from it altogether.
Absolutely. We know, right? There's so many ways to do dentistry. So I think our principal job at Ignite is just sharing objectively, here are all the ways, and here are the strengths of the ways, the weaknesses, and the opportunities that are out there for you. And everybody, I think, has to choose what they're really passionate about. And probably, as we've all experienced, that's an evolution over time. And which is another big lesson we teach is, don't be afraid to jump into the deep end of the pool and then change your mind. Because so many people are afraid of making a mistake that they just keep waiting and waiting and waiting. And they wake up one day and it's 15 years later and they haven't done anything. So a lot of it is just giving them the confidence that everything is possible and it's okay to look like this on day one and this like a day, 5,001. It's all good.
David, I would love for you to talk a little bit. Is when I first met you a couple years ago, and you and I were chatting about your journey in educating young docs and how you're participating in that journey and mentorship. And you opened my eyes to a new educational opportunity that I thought, that's brilliant. What a great idea. Because you're going in the trenches with these docs and going to their office and working with them on specific styles of cases that they wanted to accomplish. And I thought, that's number one, that's $1 million idea. And two, dang, that is so impactful for everybody involved, for you as the educator, for them as the mentee. Like, talk to me about that. Talk to our audience about that, the impact it's had on you and your journey, the impact it's having on docs that are bringing you in to participate in that process.
Sure. So first, I really wish it was $1 million idea. Turns out.
Turns out
someone says something to you and you're like,
$600K at best.
Oh.
Because you could retire if it was that type of idea.
So good.
You could.
Yeah.
No, but thanks for asking. So for me, I love digital learning. I think it's important for all of us to do. It streamlines process and we can learn an awful lot quickly. But really what we're learning an awful lot quickly is, what do we want to dive deeper on? And the ultimate learning, I think, for us is, hands-on. It's patient driven. It's not even type it on driven, hands-on. It's patient driven. It's thought process. It's all the skill sets from A to Z. So we built a program that is over your shoulder. It's in your practice. So your entire team gets to be a part of it. You work on your patients in your kitchen and we come to you. So we flip the classroom, before we come in patient selection to make sure we're treating the right people and we've dotted the I's and crossed the T's. And then when we get there, it's so much fun. We come in a day before, we do a really cool team dinner. We review everything that's going to happen in the operatory the next day. And then the next day, we literally treat your patient. And we work a lot with, I would say more complete care or cosmetically driven cases. So we prep, we scan, we temporize, we walk through the entire process. We bring all the systems. If you have your own tech and materials that you love, we work with them. If you don't, we bring them all. And then a month later, we come back and we repeat. We do another dinner to talk about what insertion is going to look like. And then we have a full day of inserting cases. And the depth of learning is amazing because we've had that flipped classroom in the beginning, but the confidence level and the nuances, like we all know this, right? Like how you prep a tooth today is like just the subtleties and the differences, define how spectacular the case looks as well as how it functions, over time. So it's been probably my favorite course that we teach. I've met a lot of tremendous dentists, maybe 70% young, 30% maybe mid-career who say like, hey, I want to level up my game, or I've always wanted to learn that. And I'm loving it. And the good news is the dentists and their teams are taking a lot from it. And And by gosh, it's a little bit of an investment, but if you line up 2 patients for the day to prep and insert, you've more than paid for the course and probably profited by learning. So it's good stuff.
So here's a question. You said you've got a breakdown. I think that I can figure out the younger dentist as to why they would feel like they need something like this, but break it down for us as to how would you, I hate to say pitch, but how would you say that the older or the more established dentist realizes that they need this help? I mean, how does that come to you? How do you get that? I'm sorry for the elementary question. I'm just trying to figure out how that happens.
Sure. So if I'm that dentist, I'm probably in my practice thinking one of a few things. I've had a patient come back at a hygiene recare with a beautiful new smile, and I'm like, whoa, how did that happen? So it just stunned me that I didn't do the work. Or more likely, I've looked at a lot of patients and thought, I know there's something that's possible. I'm just not comfortable doing it. So it's not even that those patients get referred out anywhere. I think they just remain untreated in the average dental practice today. So it's a huge opportunity to level up your game. And whether your comfort zone is 4 teeth, 6 teeth, an entire arch, full mouth rehab, it's, we've got to walk you from where you are to the next place. But, for years and years, we've talked about the $1 million that sits in your charts. And I think we could all probably argue today it's easy $1.5 million, if not more. And if you're a dentist who's out there and you're not doing the dentistry that you want to be doing, it's a great place to move to.
So I've got, first of all, a few people have chimed in. We're all commenting. We're all admiring your bush back there. That's quite a bush you're sporting.
Why, thank you.
Sorry, I could not resist that. And yes, this is a PG program, but I had to say it.
It's just
who trims that, by the way? Sorry.
and the show is over.
Yeah, you know what? You all think it, I say it. That's just how this show goes, right? Yeah.
I'm just preparing for St. Patty's Day next year.
Yeah, there you go. There you go. What is that behind you, actually?
So I'm animated as you all are as well. So rather than doing a virtual screen, I just have a half a dozen different screens, Amazon, anywhere you want, but it's just, it's paper.
But I mean, is it like a favorite kind of shrubbery or?
Oh my gosh, the details of it.
No. Yeah. Any detail to that?
I have no detail to that whatsoever, other than Anastasia is far smarter than I. And she's like, you've got a brick wall and a wood wall. You should get, some greenery back there. I'm like, okay.
Well, I think what you need are some photos of the band Rush. And I'd be happy to help you acquire those if you'd like.
That's fantastic. That will be my next episode. Rush.
Sorry to get off topic, but the ADD boy just kind of started zooming in on the background and going, man, what's that all about?
I know.
So that got awkward.
Okay. Yeah. I wanted to also highlight, I think you bring up a really interesting point, David, because when we talk about needing to keep that $1.5 million worth of dentistry in your chart, no time ever has it become more important than right now, right? Every time you send stuff out, that's production you're not capturing. And we do talk about that and staying in your comfort zone. But if you can invest in education to get more comfortable in doing those procedures that you're referring to, prosthodontists, periodontists, oral surgeons, et cetera, if we are truly headed for recession or continued increased inflation, that's the key to survival for the GP, is to increase and diversify their offerings and be able to do all the kinds of dentistry that the patients are demanding, don't you think?
Entirely. And I know, I'm sure there's some people out there that think like, oh, a recession's coming. Who's going to do aesthetically driven dentistry? It's really about interdisciplinary care.
Correct.
And whatever the patient presents with. We're not talking about, spinning down 6, 8, 10, 12 teeth for the sake of spinning them down. But let's face it, there are a lot of patients out, we were talking about this earlier, Chad, right? With wear and bruxism and clenching over the last 3 years. There's patients out there who've done a ton of damage to their teeth. And we've all had those people that we waited too long, or maybe we recommended they get care and they waited too long. And all of a sudden we throw our hands in the air because what are we going to do? They have, 4mm nubs everywhere. And it's okay. How many patients of ours are going to sign up for $100,000 worth of dentistry Monday through Friday? So it's nice to be able to intervene and help people while they can still be helped in a pretty conservative fashion.
Yeah, unfortunately, there's a lot of people that treat the symptoms rather than the problem. And, I think that I love what you're doing. I'm really excited. One of the things you were talking to me about is we've been talking about various radiographic interpretation services and stuff like that. But man, I think that Pearl, you familiar with it, David?
I am.
Man, I'm telling you, I'm hearing you and I'm thinking Pearl, and I'm like, boy, those two together can really just take a practice to the next level, because there's so many dentists that don't realize how much is sitting in the charts and how do they capture that. And then it's like, holy crap, I got all this. What do I do with it? And that's where you come in.
I think there's one more piece to that, Chad, too, which is for how many years were we taught just only fee for service, just, it's 30 or 40 grand, take it or leave it. That's what, a lot of us were taught that way. And that is not the reality of economy for most practicing dentists. Maybe for some in particular areas, but not for the average dentist. So the last piece of that is, how do we get creative so that they don't have to bite off all of that, in one huge chunk? How do we treatment plan it in a way that it becomes affordable and it becomes a process that patients can go through? And I found a lot more success in doing larger cases that way, because I don't come from a very high income area. And that's the way we do a lot of the bigger cases. It's not necessarily, okay, doc, here's your check, get started now. It just doesn't work that way. So the last piece, I love the diagnosis and I love the comprehensive treatment planning, but we've also got to be creative in how we help patients get to that without feeling like we're going to break the bank, especially now.
So I'm a Buffalo kid, and we don't do a lot well there. We lose Super Bowls and Stanley Cups. We get lots of bad weather, but we do food pretty good. So one of my favorite courses I teach is called Pizza by the Slice or the Whole Pie. And it's exactly that, Jeff. Some patients want the whole pie. They're going to get it today. Some people need a slice at a time. So we've got to break it down and segment treatment. And our principal job is to figure out who's who, so we can help them. And if I want the whole pie, you don't turn me off because you're so used to hearing no from everybody that you don't ask. And if I need a slice at a time or a quarter of a pie, that you engage me and make me feel like, yes, here's the big picture, but hey, it's okay. We have ways to segment your care over time, predictably and successfully.
All right, David, can we talk about how Dinks and IgniteDDS are collaborating and moving forward with some really exciting stuff?
Absolutely. I'm super stoked for this. So, a lot of dentists need quick, reliable, educational, I'm going to say, video, sound, photographic bites of information. And I think there's a lot of information out there, but maybe not all of it is as great as it could be. So we're teaming up together to, on a weekly basis, bring that education that you can count on. So every single week of the year, you guys should share some of the details, because I'm super stoked to be working with the three of you. There's a ton of knowledge that you all have. I'm glad we're doing this thing together.
Mine's going to be on horticulture.
Yeah.
Yeah.
So
For
David, David reached out through social media and said, hey, was looking for some people or someone to present some cases. And I thought, David, what about not just one person? What about 3 people? And so the email I got was, love it. We talked a few days later and the ball just started rolling. And I think that we have something really exciting that's going to really be different than a lot of stuff that's out there, and show that we're not just 3 people that host a show and fantastic educators each week, that we can kind of do a little education ourselves and put some stuff together and collaborate. So I think it's going to be fun. We're going to have a lot of great cases coming up. I think we owe you a few cases by the end of the month, and launch this thing next month and see where it takes us.
Yeah, I'm excited. I mean, who said it? Like, collaboration is multiplication, and we get a whole lot smarter together than any one of us individually. So this is going to be pretty epic for all of you out there on what you can bring back to your practice and your teams. I think they're going to be pretty excited to learn as well.
Can you tell them where they can find it and kind of subscribe
Yes,
or
please.
watch as that's coming through each week?
Yeah, so I'll tell all of you, if you subscribe to IgniteDDS.com, it's free for you. So please make sure you do that, and we will push a lot of the content, to social media, whether it's here on Facebook or on Instagram, at IgniteDDS. Obviously, Dinks is going to be a part of this, so you're going to see it in different places. But if you want the full story, take advantage of the free subscription at IgniteDDS.com, and it will be there. And as we develop more and more content and lanes, we'll be able to even get you some CE for it, which will be a nice little bonus.
Exciting.
Yeah, that's exciting. And I think we need to have a collaborative CE course sometime down the road.
Love it.
And there will be a center in Myrtle Beach. Hopefully around the first of the year. So
2 4-letter words that people can't live without: dink and golf.
Exactly.
In Myrtle Beach. Yeah. So, well, thank you so much, David. I really appreciate your time, and I look forward to it. I love what you're doing for dentistry. Truly love it. I know we all do. So
great to see you, Dave.
Yeah, great to see you all too. Thanks so much for having me.
Thanks,
You bet.
David.
Thank
Cheers.
you, David.
Take care, bud.
All right.
Thanks so much to our sponsor tonight, Q Optics. We didn't even talk to David about that, but he has been a fan of their loops for quite some time,
and quality aspirators.
And we're going to close with a very special image of Q Optics.